I've just never thought I'd be able to pack in. I've tried that many times and failed. But this time, and it's happened, now I'm a non-smoker. I really, really would like to thank you all because of the help. I wouldn't have done it without you. I'm Christine. I've got 5 children. Recently had a baby who's 6 weeks old now, called Flynn. When I was pregnant with Flynn, I decided to pack in smoking. The children also didn't like me smoking. They always had seen things on the telly about smoking, so they used to say to me, Mummy, can you stop smoking? It's bad for you. And I was like, I'll try. I've tried numbers of occasions, but this time I went to the clinic in the library, and Judith was there and the rest of them, and it was brilliant. It just made me feel at ease. And yeah, now I used to smoke about 20 a day.
After we've got the information, we get in touch with them and we go out and do a home visit with them at a time or a day that suits them. When we go out and do the visit, what we do like to do is include family as well, because it's not easy giving up smoking to start with, but if we get family on board, it sometimes makes it a lot easier, because we do want smoke-free environments for the babies. And we do find that a lot of husbands, grandmothers, aunties, everybody comes on the programme now. It's very hard to give up smoking, so the idea is to give support, not to wag the finger at them and say you have to do it, because it's not always easy. So when we do the home visit, we fill in the paperwork and we ask them, we go through the products, see which ones they've used in the past, whether it's been successful or it hasn't. And then we refer them to the smoking clinics. And then what we do is, depending on how they feel, they'll go to the smoking clinic 1 week, we'll see them the next week, and we usually do it over a 12-week programme. Sometimes they find that after a couple of weeks they don't need the products, in which case that we just go out and give social support, or if they need a longer time, we'll just carry on throughout the pregnancy. And what we're doing now is we're actually following them up postnatally, so if they do sort of fall off the wagon and start smoking again, there's always that opportunity to come back onto the programme.
I've been smoking since I was 13, since I was at school, and I've regretted it, but obviously when you're at school, that's what the in thing them days. But when I first found out I was pregnant, that Sue came, she just explained what we were going to do, and it was a 3-month programme. So I was on the inhalator and the patches, which worked for me, whereas before I used to be on just the patches, which didn't work, but with the inhalator as well, it seemed to work better.
My name's Catherine Story. I'm a health visitor and I'm a nurse prescriber, and I prescribe nicotine replacement therapy for ladies, pregnant ladies. They need the support, and it can be difficult for them. And we want them to come back if maybe they've had a blip 1 week. We don't want them to stop altogether coming. We want to be there for them and to help support them into getting back on the right track. That's part of our role. As a health visitor, we go into the houses and we're looking at, we're talking to people about the effects of smoking on babies and children. We do that at most visits to make sure that they're aware. And what I always say to them is, and to other family members, it mightn't be at this time that you want to stop smoking, but because it's got to be right for them. We can't say you have to stop today. It's got to be right time for them, and we just give them information as to where they go, what products is available, and how easy it is to get nicotine replacement and to stop smoking. Really, to be supported by the service. I
felt a more energy, and I felt more. I know it sounds stupid, but cleaner, because obviously the house didn't smell of smoke no more, my clothes didn't smell of smoke no more, or my hair, and the kids loved that, because obviously every time they come in the front room they could smell smoke, which wasn't very nice. And when I had the baby, I just didn't want him smelling of smoking either, because people who don't smoke can smell it on other people, which I found that now, whereas before I couldn't. I couldn't smell it at all, but now I can smell stale smoke on people who have been smoking, even if they just walk past me. So that was another thing I really like, because of now I can't smell it.
A lot of people say, well, it is because of my baby, but sometimes people say, well, I've had my first baby, I continue to smoke, but my little one, my toddler, is now saying, Mum, I don't want you to smoke anymore. Your hair doesn't smell nice. Or they're doing about it in school, and they talk about it in school. And we often get mums in then saying that they're the teachers or they've been discussing it and they've decided, the children have pushed their mums into coming to stop smoking. So it's not always just about what she wants. It can be the family that encourage her to try and stop smoking. But it does help if their partners are on board as well. It seems very unfair that dads continue to smoke, particularly outside, and they come in and they might smell of cigarettes, and that poor lady's struggling and finds it hard then when she realises that he's still having his cigarettes. So if we can get any family on board, that does help a lot.
Also, my 18-year-old daughter has recently packed and smoked, and she's been 4 weeks now, which is doing very good. So I'm really, really, really proud of her. And she said that the reason why she stopped is because her little brother's come along. So that's give her a more boost to stop smoking, where obviously before she couldn't do it. Now she feels a lot better she can, because she's got Flynn now to occupy her. So that's really good.
Hello, I'm Sheila and I'm a community midwife, and my concern is the health of a mother, her partner and her newborn baby. And we're here to talk about smoking in pregnancy and its impact on the unborn baby. And this is the machine that we use to monitor the amount of carbon monoxide in the lungs. And also it tells you of how much of that carbon monoxide goes to baby. And that has an enormous impact. When a pregnant woman inhales the cigarette, the smoke from the cigarette, it rushes through the body and through into baby, and baby's heart rate increases because baby feels as if he's having a cigarette and he can't get enough oxygen, so his heart's beating to compensate for that. Not only is carbon monoxide a problem with smoking, there are about 4,000 chemicals in cigarette smoke, most of which are carcinogenic. So both mum and mum's partner has the risk of cancer. Plaque is formed in the arteries, so therefore you've got narrowing of the arteries here, and that gives heart disease. So that's the long-term implications of smoking. This is horrible, it is, and it's a demonstration of what goes into your lungs. It's tar and all those chemicals that I said to you before, and this is smoking, the result of 30 cigarettes a day. And it's absolutely disgusting. Puts a lot of women off when you see it. Puts me off. I wouldn't have a cigarette, would you? I was a smoker, a really heavy smoker for a while, and I know how difficult it is to give up. It was one of the hardest things I had to do, but I had to do it because I wanted to be a good role model for my children. And so I tried a lot of things. And I think that one of the biggest things is willpower and the knowledge of knowing what cigarettes do to your body. I wanted to grow old to have time with my grandchildren. And I have, and I'm pleased I did it.
My name's Sarah Clark and I'm a midwifery assistant over in the central Stockton area. We would try and get them really to change a routine completely, as in maybe on a morning when they first get up, the first thing they would normally do is go down, have a cigarette and have a coffee. So what we would try and do then is make them get up, brush the teeth, get dressed before they would go downstairs. Maybe have breakfast, because a lot of these mums don't even have breakfast neither, because they don't have time. So we would try and get them and encourage them to have breakfast as well. And take up a hobby, anything to make sure the hands were active really, because then it stops them thinking about these cigarettes. Cross-stitching, knitting, even crosswords. A lot of mums have found very helpful to do crosswords to keep them busy. One particular lady that I seen was a lady who I went to see at home. It was her first baby, and she used to go to one of the children's centres, and she was saying to me that she was going to find this very hard. She'd smoked a long time, but actually she found it very easy with the support from the help from myself and from the Stop Smoking service. I used to see this lady weekly, so she got the support and the help from me going, really, to keep her motivated. This lady came back with a second baby with a partner, and she came in and said to the Stop Smoking group that she actually missed the support and the weekly visits from myself.
In the Hartlepool and Stockton area, we've got some excellent teamwork that support pregnant women that want to stop smoking. Right from the word go, if a pregnant woman rings up to book in with a midwife, as she makes that call, she's asked if she would like to stop smoking, and if she would, then one of the midwifery assistants will go out and see her at home, and a whole family as well.
If we've got any problems, we can ring the smoking service up straight away and we can get the lady sorted out, probably that same day if she is having some problems with her products.
They are really, really good, and I would advise anybody to go and do it.